from the station that's on your side. This is Channel 7 News Good Morning Arkansas.
All right, Dr. Laura Wilson of Sherwood Family Medical Center joins us today. We're going to talk about chronic abdominal pain in kids, exactly what that is and what some of the causes can be for that. Good morning.
Good morning. I thought this would be a good one because I see it all the time.
Okay, all the time.
Every kid's saying I got a bellyache.
I know,
right?
We all have it, and many times it's just something really common, right?
That's right. That's right. And parents oftentimes can present very worried about it, but the good news is most of the time it's nothing too serious.
Good.
So we talk about chronic or recurrent abdominal pain in kids. We're talking about pain that's been there at least 2 weeks. Usually when I see them, it may have been going on for months even.
Okay.
This kind of pain is usually kind of off and on, waxes and wanes, can be as vague as my tummy hurts, mama, to episodes of kind of been over cramping and pain. Usually, again, there's not an organic cause to this. That means there's nothing serious or bad going on. About a third of kids will experience it at some point in their lifetime, so that's a lot of kids.
Yeah, it's a lot.
And what may be helpful for parents to start with at home is a symptom log or a food diary to see if we can correlate this to a particular food, say dairy, or a particular time of day before school, that kind of thing. So that's kind of a starting point.
What can parents ask their kids? Because like you said, you don't know how bad is it really hurting.
That's
My
right.
tummy hurts. Okay.
That's right.
What can you ask them?
And I had one of these at my own house, and the school kept calling me about tummy pain, and we kind of worked through it. But of all the causes of belly pain in kids out there, I see 3 most commonly.
Okay.
And the first one is constipation, right? Everybody talks about constipation all the time. Well, in kids, it's super common. So with these kids, you want to talk to them about how often they're having a bowel movement and what it's like. So most parents will be like, oh, there's no way they're constipated. They go to the bathroom every day.
All the time.
Well, when you ask the kid, I'll say, is it soft? Is it easy to come out? Does it ever hurt? And then all of a sudden they'll be going, yeah, sometimes it hurts or sometimes I can't get it out.
Okay.
So in those kids, we want to first think about treating for constipation, of course. The goal for these guys would be to have 1 to 2 soft, easy to pass, non-painful BMs per day.
Okay, there you go. She said, I'm going to try to use the technical words, but sometimes with kids, you have to use some of their words, right, to get them to open up. So that's okay. Okay, let's talk about cause number 2.
Right, and that would be reflux.
Okay.
And that one can be a little harder to get a story out of a kid because they don't always say, I have heartburn or regurgitation or chest pain with it. Those kids will usually present with kind of just vague nausea, maybe not eating very good. The pain may be worse in the evenings or at night while they're sleeping. Some of them will have outright vomiting with it, and sometimes I can kind of get a story about regurgitation. I usually ask, do you have those sour burps, where the food kind of comes up and it kind of tastes yucky? They won't say heartburn or regurgitation, but they'll go,
but they know that.
That happens a lot. Yeah.
Okay, I love that. Kind of making it in their terms.
That's right. That's right.
Sometimes the food tastes yucky in my throat or something. Okay, and then number 3 is psychosomatic.
Right, and this is one that a lot of times parents have a hard time getting their head around, but this is real pain for a child. This is not fake pain. This is pain because I'm stressed or worried. And in these kids, I'm going to start asking questions about, does it hurt more before you go to school? Is something going on at school? Is somebody picking on you? Are you having trouble? Or is there something going on in the home? Are parents getting divorced? Is there some social stress? And so with these 3 causes I've just mentioned, of course, I gear my treatment towards which way we're going with it. And usually with these first 3, that first visit where we start talking about it, there's little or no workup. I might do an x-ray to look for the amount of stool, but there's not a lot we do, lab or anything like that initially, but kind of treat based on what story I get from the clinic that day.
Okay, good. And good for mom and dad to kind of keep up with what's going on. Here's what they ate. Here's what we were doing.
Right, and I think just with these 3 things I mentioned, the parents can kind of take those and ask those questions at home and see kind of which way they're going with it.
Okay, very good. Let's talk about the red flags then to really watch for.
Right, so these are kind of a bigger deal. If I have a kid that comes in with significant weight loss, maybe 1 pound is not alarming, I don't love it, but significant weight loss, 3, 5, 8 pounds, that is definitely a red flag, and I might work that kid up sooner.
Okay.
If they're having blood in their stool, now a constipated kid can have a little bit of streaky blood around the stool, but outright bloody diarrhea or lots of blood in the stool is concerning to me. Green vomit or just kind of progressive worsening of vomiting, but green vomit in general indicates a blockage in the gut.
Okay.
Now that would typically be more an acute abdominal pain thing,
Yeah.
but green vomiting is concerning. Certainly if they have fever or other systemic symptoms such as rashes or joint pain or just feeling bad, those kids I'm a little more worried about. Or just overall intensifying pain. So if you have any of those symptoms, it doesn't mean panic, but it means, yeah, I might work them up a little bit bigger to begin with,
yeah.
you know?
And maybe something different between my tummy hurts and you said like almost bent over sometimes. You've seen them there, and that can give you an idea of how bad it is as well. Okay, so don't panic.
Don't panic.
A lot of kids have tummy aches for many different reasons, and you just got to come in and sort of work through it if it looks like it's a problem.
That's right.
Okay, thank you.
Sure,
we
no
appreciate
problem.
it. Let's put up the information, of course, about Sherwood Family Medical Center. You can go see them, give them a call, set up an appointment. She can take care of your kids, that's for sure.